Hi, welcome, Dr. Riney. Welcome to Deep Into Sleep podcast.
Thank you for having me.
So I'm very excited. I know you've been in the sleep medicine field for a while. And to get started, just want to, how about you introduce yourself a little bit to our audience and help us understand what got you into the field of sleep medicine?
Absolutely. So I am actually a neurologist by training. So I trained down here in Atlanta at Emory many years ago. I don't want to say how long ago because it will age me. And I got started after my neurology residency. I had a big passion really for looking at preventive health, and I saw a lot of that with sleep. So we are in the stroke belt, and we found that when you're seeing people with the catastrophic effects of stroke, you want to know what can we do to reduce the risk of that happening. Or just definitely in neurology, there are a lot of things like chronic pain as far as headaches and back pain that we would also see. And the idea that working in a field where you might be able to reduce the risk of that happening or the effects that has on someone was really exciting. And you get to work with kids and adults, which also was a passion for me. So that was how it started. And and started at Fusion Sleep Clinic, which is here in Atlanta, and was medical director there, still medical director there, and then became chief medical officer of Knox Health, and that was earlier this year.
Oh, congratulations.
Thank you.
Wow. So you've been in this field working with like general neurology medicine, and then you see a lot of sleep problem. I'm curious, what kind of common sleep issues you've been observing in your patients, both adults, children, that got you really interested?
So initially, I mean, a lot of it we would see, and I saw a lot of it more when I was, I think when I was going through my residency, I didn't notice it as much. And part of it was we didn't really get taught a lot about sleep medicine in our training. I think in medical school and residency, you're seeing all these other things, and we didn't have as much time devoted to it. And I think that's still universally an issue that we would hopefully like to change. I think we've talked about the passion of sleep medicine and educating as many people around about how sleep impacts everybody. And so I think definitely when I, got involved in sleep medicine, I was able, then the questions to ask and what to see. And really, everybody is impacted by, sleep disorders of some sort. It's such a prevalent issue that's very much underdiagnosed. So, definitely we see a lot with obstructive sleep apnea, insomnia, restless leg syndrome, delayed sleep phase or circadian rhythm disturbances, disorders of what we call sleep and wake cycle. So, are people who are, may have narcolepsy or idiopathic hypersomnia. And so there's a lot of things that we see that people don't realize may be related to their sleep. And so, and definitely we know that it can have impacts in the issues that they have. So both short term and long term.
Yeah, I totally agree. I remember in my clinic, I used to see some teenagers,
Yeah.
and they came in, describe all these symptoms related to narcolepsy, but they have no idea, right? They were diagnosed as like psychosis and depression, being on medication for years, nothing worked. So that's very sad. It's just not a lot of people really think about the possibility about sleep disorders.
You're exactly right. I mean, and I think that's a common thread where people may go literally for years and years and they go to a ton of doctors. I mean, we definitely see that people have sleep disorders spend more money, than others, both as far as clinic visits, prescriptions, and a lot of it I think is trying to search for why do I have, what do I have? And they'll go to multiple specialists because they might have a couple different things that are related to potentially an undiagnosed sleep disorder. And that's part of the education that we want to do is to say, at least think about it, ask the questions early on, because one, we might be able to hopefully prevent or reduce the risk of some of these chronic diseases, but also give people this diagnosis early or give them the tips and the tools to say, hey, do I have something going on? And, we find a lot of people are really well educated now, I guess, as far as looking for, and a lot of times they're their own advocates, which I love.
Yeah, I know there's a lot of support groups out there, and people really help, advocate for what they've been through and help people understand. So if someone, they've been trying to find some answers in their own symptoms, not sure what yet, and they are questioning sleep issues. Where can they find solid, well-trained doctors that understand sleep issues? Is that easy to find nowadays?
It's a very good question. Part of what we did initially, and part of what we do as well as, and I'll kind of explain a little bit more what we do with Knox Health is, try to give people access to come to the right place, and really developing a community and relationships with referring physicians and specialists to help guide people to come find someone who can help answer those questions. And so that is part of our goal. So, with Fusion Sleep, we see people in our Atlanta community. And then we also have Sleep Charge, which is a national telemedicine-based program where we have sleep medicine physicians who can see anyone nationwide through a telemedicine platform. And, but I think part of it is, you're right, it's guiding people to know where to go to once they start thinking, yes, I have something maybe going on that may be related to my sleep.
Right, right. That's awesome. That sounds like Knox Health has really put together all these resources. So, it's easier for people to just go to one place and find the resources.
That's the hope. I mean, one of the passions I had with sleep initially, I think, sleep definitely is unique in that you can come from a lot of different specialties and do a fellowship in sleep medicine. So it is multidisciplinary, which I love that. I think sometimes what happens because of it is it can become fragmented, because, it can be incorporated in your practice. And, sometimes the testing is in one part, the treatment's somewhere else. And the one thing that's been really nice about only doing sleep is, one, you can work with your community partners to say, hey, we're here to help, but you can take care of someone from the beginning to the end and continue to continue that follow-up process, which is really key, because so many things that we do in sleep is behaviorally based, and changing one's behaviors is really hard. Mm-hmm. And it's really easy to go back to what you're doing, and having someone who kind of keeps you accountable, I think ultimately helps someone successful in their therapy.
Yeah, yeah. Oh, I love that. For myself, I treat insomnia, and sometimes definitely I hear symptoms of sleep apnea, right? So I have to think about, where do I refer this person to get a sleep study or to get other things checked out? Then I have to refer them to all kinds of different doctors and clinics nearby, and then try to get the result back. It's really hard.
It is hard, exactly. And I think, people are like, you know what, I'll do it later. And you see that a lot. And so if you can make it easier so that they don't have to think through that, and, really kind of meet someone in the middle to say, we want to make this as easy and support you. It would make your life easier also.
Yeah, I definitely have patients. They said, okay, I will do that. And then where they go has a long waiting list. Yes. Then after several months, I check in, they still haven't done that.
All of those are correct. Absolutely. So so our goal is hopefully to minimize all those barriers, because there are a ton of barriers that people go through, and it's hard to take time off of work or pull kids from school to do it. And so finding a way that works, but also taking away all those, what we call those, pain points, like, working with insurance if it's there, and getting the test to them either in their home or in the lab, depending on what's appropriate. Going through all the therapy options and addressing every issue they may have that may impact, their therapy. So if they do have coexisting, if they have sleep apnea coexisting, insomnia or restless legs, addressing it together and figuring that out and saying, hey, we're here to keep following you through this journey to make sure you're successful.
Yeah, I love that model. I always love that, like, one station for all service, this kind of like, systematic thing. And but I'm curious myself, in my own clinic, I do see an increase of numbers of patients seeking help over the past several years, especially after COVID. I think people's lifestyle changed dramatically, right? And right now, people are trying to change back. That's another round of transition. So I'm curious, for you in your practice, in different organizations you've been working, do you notice similar trend for patients seeking sleep-related treatment?
100%, for all the reasons you described. I mean, COVID, there a lot of things happened during the time of COVID. Definitely habits changed for sure, where now people's living environment became their work environment. And, for some people, they became also teachers to their kids. And so now you had that in there, or people who were used to traveling for work no longer could do that. And also, so one, sleep schedules were altered, and we saw that people were following it or maybe delaying their sleep time, almost what we call that social jet lag. Where now, hey, I can stay up a little bit later. Maybe we can, binge watch some shows a little bit more. We can sleep in a little bit. And that caused issues. On top of it, we have people now who maybe were sharing beds with a partner that they weren't before because maybe they were traveling, and they could identify, hey, there are more issues with your sleep, your snoring is affecting me. And so you get this checked out, or, anxiety, definitely was amplified during this time and still there. And that definitely impacted sleep. And then the reverse is true. If you have poor sleep, it definitely adversely affects anxiety, depression. So I think definitely we saw an uptick in people coming in for either, changes in their sleep cycle, more issues with, sleep apnea, either at least being identified or wanting to be addressed now that they were in that home environment, and insomnia. Absolutely.
Wow. Yeah. And right now people are start going back to work in the office again. And I heard a lot of complaints. And this weekend, we're going to have time change. I know that is hard for some people too.
It is. This one is a little bit gentler than the one in March, where at least we can gain, we gain that hour, but it's hard whenever you have a time change in general. People definitely feel the effects of it. And especially when we lose that hour and, extend the day, that's a very hard, hard issue for people. And we definitely see more sleep issues during that time. And so a lot of it is hopefully, educating as much as we can on getting your body ready. Maybe, in this one, maybe the day before, the one in March, a couple of days before, so that maybe it's not such a dramatic change when it happens. But yeah, I mean, definitely we see more issues where they are much more sluggish that week after. Our teenagers really feel the effects of it. Definitely we see more, car accidents and cardiovascular events during that week.
Oh, yeah. Could be very dangerous. So since we
Yes.
talk about that, we touched this a little bit. So we still, when this episode is out, possibly people already finished that time
Yes.
change. Yeah.
Oh, that's true. Okay, we can.
But I'm still curious for
Yes.
future reference, right? One
Yes.
day before this November time change,
Yes.
what are some things you think could be helpful for people?
So I think, maybe even setting your clock to get ready for it, even the day before, maybe giving yourself a little bit more daylight, even in the evening hours, just a little bit, like going outside. Keeping, always say keep a consistent sleep and wake schedule is always an important thing as well. But, I think at least the day leading up to it, that Saturday, is when you want to start getting ready for that time change the next day. And then the one in March, you usually want to do it a few days beforehand.
Oh, that's great. Thank you, Dr. Riney, for sharing all this wonderful information with us. If any audience are curious about your work, where can they find you or read more about your work?
Absolutely. So our website is knoxhealth.com, and I welcome anyone to come check us out. And yes, we are here and we want to help.
Yeah, definitely love that. Thank you so much, Dr. Riney.
Thank you.
Nice talking to you. Bye.
Nice talking to you. Have a great day.